Good evening, ladies and gentlemen. It's truly an honor to welcome you all here this evening as we unveil a campaign that's close to our heart, the Take Charge campaign, in partnership with Times Network. At Novartis, we believe that healthcare is not just about medicines. It's about people, their stories, their journey, and the power of hope, empowerment, and resilience. Breast cancer today stands as a leading cause of cancer and cancer-related deaths in India. Every year, close to 190,000 women are diagnosed with breast cancer. That's one woman every 4 minutes. And heartbreakingly, every 8 minutes, we also lose a woman to this disease. What makes the Indian scenario even more concerning is that nearly 48% of these women are under the age of 45 years, much younger compared to the Western world, where this ratio is around 28%. This not only impacts individuals, but families, children, community, and truly the soul of our society. However, there is always a silver lining. Advances in medicines are giving us new hope. The 5-year survival rate for breast cancer in India has increased significantly, from around 40% quite a few years back to 60%. This is not just a number. It's a reflection of science, investment in innovation, collaboration, and most importantly, human resilience. One needs to remember that breast cancer does not have to mean the end of life. Many women today continue to live with dignity, purpose, and positivity, redefining what it means to be a survivor. And survivorship is not a clinical outcome. It comes with emotional weight, societal perceptions, and visual stereotypes. Too often, all treatments are painted with the same brush, without acknowledging that every patient journey is unique, and the outcomes can vary based on individual patients. That is why personalized care, tailored by their oncologist, is key to improving both survival and quality of life. And let's not forget, even after early detection and treatment, recurrence remains a real fear, in some cases as high as 50%. This underlines the need for ongoing care, advanced therapies, and most importantly, patient empowerment. There is a saying, knowledge is the antidote to fear. And we believe that empowered patients and caregivers are the cornerstone for better health and better patient outcomes. At Novartis, as a patient-centric organization, our mission goes beyond treatment. It's about creating a future where patients have the courage and clarity to take charge of their lives. We must support them, not just at the time of diagnosis, but through every phase of their journey. This includes giving them confidence to have honest, informed conversations with their doctors and care teams. With this vision, we at Novartis are very proud to launch the Take Charge campaign, a movement built on the pillar of hope, positivity, and empowerment. This campaign is being launched for the first time in collaboration with the Times Network Group. It aims to reach patients and caregivers across the country, helping them to understand that they are not alone, that their lives don't stop at diagnosis, and they have the power to shape their own story. Whether it's making informed choices, seeking the right treatment, or simply finding strength in their everyday lives, Take Charge is here to be their companion on this journey. As we unveil this campaign today, I want to extend my heartfelt thanks to all the oncologists, patient groups, survivors, caregivers, nurses, partners, and every single individual who is a part of this mission. To all the women who are fighting breast cancer and to their families, I want to say, you are not alone. We see you and we stand with you. Together, let's build a future where survivorship is not about living longer, but also about living better. Let's take charge of health, of hope, and of life itself. Thank you, and I wish you a very inspiring evening ahead.
What inspiring words from Mr. Dube. Huge round of applause. A very powerful message there once again. And we'd now like to officially launch the Take Charge campaign that you've been hearing so much about. And to help do the honors, if I could please have Rohit Chadda back on stage, please. The CEO and President of Times Network, ladies and gentlemen, to join Mr. Amitabh Dube for this incredibly special moment. Ladies and gentlemen, please put your hands together as we're about to unveil Take Charge, a step towards reimagining life after breast cancer.
Every year, 190,000 women in India are diagnosed with breast cancer. That's one woman every 4 minutes. Nearly 48% of these women are under the age of 50, much younger compared to the West. Breast cancer doesn't just impact individuals, it impacts families, communities, and the very soul of our society. However, there is a silver lining. Advances in medicine have brought hope. India's 5-year survival rate for breast cancer has risen from around 40% to over 60%. Yet, the risk of breast cancer recurrence remains, sometimes as high as 50%. But with the right information and empowerment, even this risk can be reduced. Introducing Take Charge, a public health initiative that aims to inspire women and caregivers to take control of life post-breast cancer diagnosis. Focus on proactive coping strategies to reduce the risk of breast cancer recurrence while maintaining quality of life. Whether it's making informed choices, seeking the right treatment, or finding strength in everyday life, Take Charge is your companion through this journey. Remember, you are not alone. You have the power to shape your story by taking charge.
How moving was that message? All right. With that, thank you so much. And Mr. Dube, we ask that you please remain on stage for just a moment longer. Thank you so much, Rohit. And let's see. Now, we're going to take this conversation forward. All right? And to do just that, if I could please invite on stage Ms. Amitabh, who's the senior news anchor with Times Network, to the stage as she engages in a special one-on-one session with Mr. Amitabh Dube. And this session is aptly titled Taking Charge, Reimagining Life After Breast Cancer. It promises to be a particularly moving session, and we're very much looking forward to it. All right. Okay. Thank you so much. Looks like we're about ready to begin. And just by way of reminder, I think you're all familiar with our partners in this effort. We're powered by Intas, we're co-powered by Novartis and All Out. Our knowledge partner is Dr. MGR Educational and Research Institute. Our supporting partner, Fit India, our strategic alliance partner on Excel Communications, our wealth partner, Nuvama Wealth, and our outdoor partner, Heights. And with that, we'll now hear from our co-powered partner, Novartis. Mr. Amitabh Dube, I give you the floor. And Amita, it's over to you.
Thank you, Pooja. Good evening, ladies and gentlemen. It's great to have you with us. And Mr. Dube, thank you very much for taking out your time. It's been quite moving as far as your message is concerned. And when we speak of take charge, breast cancer, every woman's concern, and we've seen the statistics, however, they're not looking bright. But when we take a look as far as how to avoid early diagnosis, that seems to be, when it comes to center of this initiative that has now begun on part of Novartis, which is called Take Charge. And as this initiative talks of, Mr. Dube, how does it actually align when we speak to Novartis, taking it forward as you spoke in your keynote address, but can you elaborate a little more on it?
Thank you, Amitabh. It's really a privilege and honor for me to be here. This campaign is extremely personal and professional to me. I've been 30 years in the oncology space, and I've seen science evolve and move the outcomes based on patient individuality. Let me give two scientific examples onto this. The first one is in an area which is known as chronic myeloid leukemia. When I started almost 30 years back, we had hardly two treatments available for patients with chronic myeloid leukemia. It was hydroxyurea and interferon, with survival rates less than 5%. And we used to hear about talks of innovative treatment coming out, which will change patient outcomes. And then we had tyrosine kinase inhibitors, imatinib hitting the market, which changed the way CML was treated from being a deadly disease to a chronic treatment. And then came the second generations of TKI, and then the STAMP inhibitors today. Today, when we look at this disease, patients continue to stay years and years with chronic myeloid leukemia. And there's a talk happening around treatment-free remission, where we believe that patients with few years of treatment can go undergo remission, and they stop the treatment, then disease doesn't come back. That's the advancement of science. Looking at breast cancer, quite a few years back, all patients were painted with the same brush. One type of treatment, chemotherapy, not individualized. Over the years, the science has really taken innovation to the next level. We have each patient, there have been different surgical advancements, there have been imaging advancements, there have been diagnostic advancements today with genomics coming into play, and then there's been therapeutic advancements. And we at Novartis truly believe that this is one of our mission, to make treatments go personalized to every individual for cancer. And that correlates to the mission of Take Charge, because taking charge doesn't mean that just taking charge of your disease. It also means to have that informed consent and conversation with the doctor, which talks about your personalized care, personalized outcome, personalized benefit, personalized well-being. So it's all about taking charge of your disease to have your own outcomes of your disease.
So when you say personalized treatment, Mr. Dube, how would you highlight when it comes to greater access and affordability that this message reaches all, especially to women, their families? As I said, early diagnosis is the key, but preventive measures, what can be undertaken, especially when you spoke of the age, less than 50 years of age. That is a number which is staggering, and it is also a concern. How do you, focus on wider outreach?
Again, an excellent question, Amitabh, and thank you so much for asking it. Access is about two things. Correct. One is ensuring that everybody is aware about the diseases and their outcomes. And the second is access about treatments. We together in the society and everybody have to play part so that we are making more people aware by having those conversations where people are comfortable to have conversations about cancer. Generally, it's believed that cancer will strike everybody except a particular individual. And that's why people are not ready to have the conversation. When it comes to regards to matter and the patient is the center of it, I must want to compliment the government here and congratulate them to a lot of initiatives as they have taken. Cancer is a central part in a lot of central government initiatives. Ayushman Bharat is one of them. A lot of state governments have specific cancer-driven programs to drive access for medicines. But in spite of these initiatives, Amitabh, only 38% of population today is insured. And in spite of all the advances which is being made, the innovative treatments are less accessible to patients through all the government's channels that are available. We need to work together how we can make these channels available. From our side at Novartis, we do play a very important part, and we try to see that we have patient support programs. We have been working with the UP government in 2 districts to work on a continuum of care, basically, and that is basically not to go right down to the individual level. We have trained ASHA workers in that 2 districts where these ASHA workers go house to house, talking to females in their local language, educating them about breast cancer, helping them to understand self-breast examination, and if any person is found with a lump or an early signs, they are referred to district hospitals, and then they are referred to cancer treatment center or center of excellences for cancer treatment. That referral pathway and ecosystem has been created in 2 districts, and we are partnering with the government. That is always going to be there, but affordability should not be the reason why a patient shouldn't be able to get medicines. And to answer an affordability challenge, again, all stakeholders need to come together, because affordability cannot be only the answer of government, or affordability cannot be only the answer of a pharma industry. We partners have to come together, find out a sustainable solution which makes new innovative treatments more accessible to patients across the country. It could be through insurances program, could be through better packages in Ayushman Bharat, and could be through companies looking at innovative funding mechanism.
In the long run, how are you looking at your campaign, sir? Because when we speak of future care, does it only limit itself to breast cancer, or other cancers in general? Does it cover them too?
So when you talk about take charge, as we know that in India, breast cancer is one of the leading cancers today. We want every woman in India at least to be aware and should have the power to take charge of her own health with regards to breast cancer. We are continuously focusing currently on breast cancer as an area where we want to go deeper and ask every woman to take charge for their own health. If it goes well, then we look forward to making this campaign a more wider campaign.
So do you foresee any challenges or opportunities in this campaign?
I see only opportunities. I see that there is a huge segment in India which, if takes charge, can be early diagnosed, and we can have potentially better outcomes for patients.
So any message that you want to give across, as you said in your keynote address, that the women should know that they are not alone, that they have a family, that they have you, that they have Novartis, and that they can take forward as far as the Take Charge campaign is concerned? Any message for those women?
I have a message for every stakeholder. I want to request the government that let's together take the collective responsibility and take charge for better patient outcomes. I have a message for the doctors. I want to say thank you for taking charge for having better patient outcomes. I want to thank the researchers, and I want to tell them thank you for innovating new treatments that have better outcomes for patients, and thank you for taking charge to change and bend the curve of life for cancer patients. I want to thank the media partners too here, and I want to tell them that, guys, we together need to have the collective responsibility and take charge to make this campaign reach out to every segment in the society and across the country. And finally, I want to say to patients and caregivers, you are not alone. There's a huge amount of hope. There are better treatment outcomes coming. So take charge of your own patient outcomes for better and brighter quality of life and outcomes.
Well, that sets in motion as far as Novartis' campaign is concerned. Take Charge, Reimagining Life After Breast Cancer. Thank you very much, Mr. Dube. It's been enlightening speaking to you. And of course, this campaign, much success to you and to Novartis. Thank you very much. Big round of applause, ladies and gentlemen. Mr. Dube, request you to be on stage with us. Yes. Thank you very much, ladies and gentlemen, for joining in.
All right.
Over to you.
Can we please have Pooja Sethi back on stage to felicitate Mr. Amitabh Dube with a token of our appreciation. And thank you, Amitabh, for guiding us through that discussion. Mr. Dube, we want to acknowledge you. We want to felicitate you for your valuable contributions. Our heartfelt thanks to Novartis India, led by Mr. Amitabh Dube.